So this is your, we call it the, we call it the TNM staging. Okay, so we have tumor size. So sometimes in the exam they can ask you what T represents. T represents the tumor size, N represents the lymph node, and M represents metastasis. So tumor size. Under the tumor size, if the tumor size is less than 2, because they will ask you the tumor size, let's say is less than 2, then that is T1. If the tumor size is between 2 to 5, that is T2. If the tumor size is greater than 5, that is T3. Then if the tumor site have invaded the skin or the chest wall, then that is T4. Because this is, when they do the diagnostic test, you are interpreting it. Then when you do the lymph node, if there is no lymph node involvement, that is N0. If there is movable, if it has moved to if there is a movable ipsilateral axillary node, then that is N1, movable. But if it is fixed, because that is the word they use, if it is movable, it is N1, metastasis to ipsilateral. So ipsilateral, if it's movable or it have metastasized to ipsilateral place, then that is N1. But if there is metastasis to the ipsilateral fixed, then that is, so when we talk about ipsilateral means same side. If the cancer that is on the same side of the cancer, so the same lymph node. So let's say, because we say the movable ipsilateral axillary node, so in the axilla, which is the armpit, so the lymph node that is located in the armpit, if it is the same side, that is why we say it is N1. But if it is fixed, it's not movable, that is N2. Then if it has metastasized to infraclavicular area, supraclavicular, so it has metastasized to those areas, then that is N3. Then metastasis, which is M. If there is no distant metastasis, that means it has not moved to, let's say, to other organs. If there is no distant metastasis, for example, somebody may have breast cancer, then the breast cancer now, sometimes they start seeing it maybe in the spine, in the bone. If it has not metastasized, then that is M0. But if it has metastasized to other area, that is M1. So this is how the questions look in the exam. Something like this. They can ask you, a 62-year-old female with breast cancer has a tumor that is 3 centimeters. So what is this telling you? 3 centimeters. So if it's 3 centimeters, it is somewhere here, which is T2. 3 centimeters, which is T2. So I'm going to choose options that have T2. So that means my option will be among these B and C, because it's T2. Then in size, it involves mobile ipsilateral level 1 axillary lymph node. So mobile, movable ipsilateral, which is this N1. So I look at option that have N1. So here I'm already seeing my answer. And shows no evidence of distant metastasis. So which one has no distant metastasis? That is M0. So that is your answer, T2N1M0. So you will see some of these things. That is the staging. If you don't want to start writing all this long thing, you will just put T2N1M0. So what does that mean? You are saying that the tumor size is which is between 2 to 5, okay, which is here T2. Then you also say that it is ipsilateral movable N1. Then there is no distant metastasis, which is M0. So that is how to arrive your answer. And sometimes they can ask you in the TNM staging system, what does N represent? I said that we have TNM. N is your lymph node. Lymph node. So what does that represent? Number and locations of the regional lymph node that is involved. The primary tumor, the size is the T, so that is A. Presence of distant metastasis, that is your M. But what they are asking you is N. N is your lymph node. So let's do one more. Okay. What does M component in the TNM staging system represent? M, we say that M is your distant metastasis. So if you select distant metastasis, you are correct. What does mobile ipsilateral lymph node imply? So mobile ipsilateral, which is here, mobile ipsilateral, that is N1. Mobile is N2 is ipsilateral fixed, fixed. So mobile ipsilateral. So lymph nodes on the opposite side of the body that are fixed. It's not fixed. It's not fixed. So throw that one away. Lymph node on the same side as a primary tumor that can be moved, yes, and are not fixed. Lymph node on the both side is not both side. It's not both side of the same. Lymph nodes that are not involved, that is not correct. We say that ipsilateral is the same side as the cancer. So on the same side as the cancer. So same side lymph node. Okay, so is at the same side of the cancer. So that means the answer is B, lymph node on the same side as the primary tumor. And this is the final one. A patient with a primary tumor that cannot be measured. So the tumor cannot be measured, which means there is no T size. T cannot be measured. That is what they said. It cannot be measured. So T is 0 because it cannot be measured. So I will use option that will just put me any between these two, because they say T tumor size cannot be measured. So I will go with this. I will not go with the C and D. Then between these two, now let's see next thing. It cannot be measured and no evidence of regional lymph node involvement. So no evidence. So no lymph node involvement, which is NO. NO. And no distant metastasis. No, everything is 000. No metastasis, no lymph node involvement. That is it.